Well, now a KOLR10 investigation tonight. For the last few weeks now, or nights I should say, we've been tackling the topic of skyrocketing prescription drug costs in recent years.
Total spending on prescription drugs in the U.S. went up about 41% between 2007 and 2017. In our reporting, we've looked at local resources that help people pay for the meds they need, and we examined how businesses have to balance profit versus providing health coverage for employees. To conclude our KOLR10 news investigation, we turn to our Brian Calfano with more on how lawmakers could potentially help curb costs.
Well, talk about lower prescription drug costs doesn't get too far before the question of whether and what government can do to encourage lower prices comes into play. But the federal government in Washington, D.C. seems paralyzed, unable or unwilling to act. And that's why it's fallen to state officials here in Missouri to take up the need for price reform.
Prices are increasing, and we really need to be working on that and working on how to lower those drug prices for everybody.
St. Louis area State Representative Sarah Unsicker is concerned. Time is moving fast for the state legislature to act on bills that would bring price relief on prescription drugs for Missouri families. And like the state capitol building here, consensus among state elected officials on lowering prescription costs is, well, under construction. But unlike other issues that cause political squabbles, there's a general consensus in both parties in Jefferson City that something needs to be done. The question is, what? Representative Unsicker and her House Democratic colleagues want the state to set price ceilings on prescription costs. Meanwhile, Republican State Representative Steve Helms has a different idea and thinks that buying prescriptions outside Missouri will help.
Allowing Missourians to either buy in Canada, Great Britain, or England, or another country that we know have good standards should be a no-brainer.
The challenge, though, is that prescription drug cost legislation is getting lost in the policy shuffle. It's only one of dozens of critical policy items the state legislature must consider this session. Remember, state senators and House members only have until May to come up with bills that must pass in the same form in both legislative chambers before they can go to Governor Mike Parson's desk, and then the governor must decide how he wants to act. We're at the end of February now, so there's not a lot of time. Representative Helms's bill is just getting started on its road to committee hearings and potential votes in the House. Action from the Senate side isn't really on the Senate's radar screen yet, though it sounds like Helms's bill would have support from Republican State Senator Eric Burleson.
Representative Helms has got a great concept, and it's worth exploring to see if people can be able to purchase pharmaceuticals at an affordable price on the internet. As long as they've got that prescription and they've got the ability to do that, then we want to empower people to get the best price out there.
Speaking of the Senate, Kansas City Democratic Senator Lauren Arthur has introduced a bill to, in part, require the pharmacy benefit managers who negotiate which drugs are made available for sale at which pharmacies and for how much to report just how much managers receive in rebates from pharmaceutical manufacturers. And House Minority Leader Crystal Quaid reminds us that there's also a need to support the state's existing drug cost programs, which have been cut in recent years.
You know, we're about $300 million upside down as of today. And the MORX program, in-home nursing care cuts. We've seen a lot of cuts over the years that I know a lot of my constituents would like to see restored.
It's not surprising that Republicans and Democrats are far apart, but failure to do something on these bills means Missourians will have to spend yet another year deciding what else they can cut from their already lean budgets to afford the medications they need. Well, David and Heather, there's obviously a desire to get something done. The question is what? Both parties in Jeff City want to make inroads on this problem for Missourians, and they need to do so by May to get the bill to Governor Parson's desk. Question now becomes whether both sides can make this happen in time.
And I think as we embarked on reporting these series of special reports for you, we all learned information. I mean, you know, there are resources locally that I didn't know about, perhaps you didn't know about. We talked about the Salvation Army. We talked about MoHealth Net. We talked about the MSU Care Clinic, and you know, a lot of folks may not know those places exist.
And something I learned that is coming more predominant in the medical field after speaking with this doctor was that just over the past 10 years, these medical clinics that are basically like membership fees for primary care physicians are able to help with the insurance coverage, and you know, you don't have to pay as much as you would out of pocket, and you get wholesale drug prices with that membership as well.
Sure.
Well, I think it's also important to remember that even though there's a lot of focus on what little kids need and what older Missourians need, everybody across the age groups needs relief in terms of getting affordable prescription drugs. It's not the sort of thing that people in their 40s and 50s can just deal without having medication. So even though there are programs for kids and for seniors, it really has to be an across-the-board approach if it's going to work.
As we mentioned our first night in this series, we're talking about 9% annual increases and 15% annual increases in drug costs over the last 8 years or so. There aren't many other products in our country that have seen that kind of growth percentage year to year.
No, that's right. And income's just not keeping up. Even though the unemployment rate is really good and you have some wage growth, it's not going to keep up with 9% year-over-year increases.
Brian, thanks for your input on this. We appreciate it.
And thank you for joining us for this series. You can find each story that we did on our website at ozarksfirst.com.